Hi, my name is Latoria Scary, and I will be doing an informative speech on hepatitis. I will start my speech off with the quote from GreatPersonalities.com. Liver disease is a serious public health issue in our nation as it currently affects more than 30 million Americans. Diseases such as hepatitis are often referred to as silent disease because liver damage can gradually occur over many years before being discovered, which often happens once the disease is irreparable. Nationally, hepatitis B and C are major causes of liver cancer, liver transplantation, and even death. For the next few minutes, I will provide you with information about hepatitis. First, I will explain the cause of the disease, how it is spread, and its symptoms. Next, I will outline what would happen if the disease is left untreated. Finally, I will discuss ways to prevent you and I from contracting hepatitis B. I will begin by explaining what hepatitis B is, its causes, and also how it is spread. Hepatitis B is a serious disease that affects the liver. Hepatitis B is a liver disease caused by an infection with the hepatitis B virus HPV. It ranges in severity from a mild illness lasting a few weeks to a serious long-term illness that could lead to liver disease or liver cancer. Hepatitis is caused by the hepatitis B virus HPV. HPV can cause two types of illnesses. The first illness would be acute, which is short-term illness, is more common among adults. Children who become affected usually do not have acute illness. Chronic, which is long-term illness, is more common among infants and children than among adults. This can be very serious and often leads to liver damage, cirrhosis, liver cancer, or even death. Hepatitis B virus is spread through contact with the blood or other bodily fluids of an infected person. A person can be affected by unprotected sex, injecting drug use, using unsterile needles and ear or body piercing, tattooing or acupuncture, sharing items such as razors, toothbrush, or washcloths. Infected body fluids such as blood, saliva, semen, vaginal fluids, tears, and also urine. According to the Hepatitis B Research Network, if a pregnant woman is infected with hepatitis B, it is possible for her to spread the virus to her child during childbirth. Now that you have a general understanding of the causes and the spread of hepatitis B, I will now discuss what signs and symptoms to look for, and also what will happen if the disease is left untreated. Symptoms of an infection with hepatitis B, HPV, if they appear at all, usually begin 60 to 90 days, although they can appear from 45 to 180 days after the virus enters the body. Some of the signs and symptoms that one may experience would be fatigue, abdominal pain, and loss of appetite, nausea, vomiting, joint pain, as well as jaundice, which is the skin and whites of the eye appear yellow. Jaundice is a major indicator of hepatitis B, but it often doesn't appear until other symptoms have started to go away. The staff at the Mayo Clinic says that most infants and children with hepatitis B never develop signs and symptoms. The same is true for some adults. If left untreated to the point that the virus develops into liver cancer, there is more than likely the chance of it being fatal. Some people who contract hepatitis B may get well on their own, others may get well but still have the virus in their bodies, so even though they feel fine, they can pass the virus on to others. Sometimes the virus can damage the liver to lead liver cancer or death. As you can see, we now know the signs and the symptoms and also what happens if the disease is left untreated. Finally, I will discuss who's more at risk for the disease and ways to prevent you and I from contracting hepatitis. About 5% of people in the U.S. will get infected with HPV sometime during their lives. If one engages in certain behaviors, you and our risk may be higher. Who is at risk for HPV infection? People who is at risk for HPV infection? People who have jobs that expose them to human blood, inject drugs, have sex more than one partner during a 6-month period, persons whose parents were born in Asia, Africa, sharing a household with someone who has lifelong HPV infection, and the list goes on. This is just some of the view. Because hepatitis is contagious, here are some ways to protect yourself as well as your family. Wash your hands thoroughly after touching your body or infectious body fluid. Get vaccinated. There's a series of 3 shots. Wear gloves if you have to touch someone that is infected. If you're going to have sex, make sure you use a condom. All children should get their first dose at birth and should have the vaccine completed by the age of 6 through 18 months of age. There is no cure for hepatitis B. There is a vaccination that will protect you from getting it. The vaccination is given in 3 shots over a 6-month period. The information that I have given you today could help save someone's life. So please, get tested. Now I will bring my speech to an end. For the past few minutes, I have provided you with information about hepatitis B. I have explained that it is a disease caused by the virus HPV and also the spread of the disease. I provided information about the signs and the symptoms of the disease and also what would happen if the disease goes untreated. And last but not least, I discussed people who are more at risk and also ways to prevent yourself and others from contracting hepatitis B. I will end it with a quote. Hepatitis A and B are vaccine preventable diseases. Yet they continue to be the most commonly reported vaccine preventable diseases. Getting vaccinated, especially if you are at high risk, provides the best protection from this disease. Thank you.